Back to RSI Help YouTube. As promised, we're going to be talking with Dr. Nick Wisniak about glenohumeral instability problems, and they can be really hard. It's a shoulder problem that I'll let Dr. Wisniak tell you. But before I begin, he's written some textbooks, and one of them that's really helpful is this muscle manual, and in it you'll find great illustrations about the anatomy that you're going to be learning about. So you can think about getting that on Amazon.com. Dr. Wisniak is of Pro Health Systems in Vancouver, Canada. He's written many textbooks. He teaches anatomy and cadaver dissections and all kinds of wonderful things there. And we're lucky to have him on the show. So welcome back, Dr. Wisniak. What can you tell us about glenohumeral instability and why it would be important to people who are using computers or other technologies?
Yeah, absolutely. So this is one condition that a lot of people don't recognize is, number one, first of all, you want to break down even what the name means. Glenohumeral, that is your shoulder joint. Now, it's not where your scapula moves up and down. It's actually where the head of your humerus articulates with your scapula right here. So it is glenohumeral instability. Now, what determines the stability of your shoulder joint? It's about 50% the rotator cuff muscles and another 50 or so percent the ligaments that wrap around. And what happens for people is when their muscles become hypoactive, less active than they should be, or less strong than they should be, or the ligaments start to get extra loose, this joint starts to slide around all over the place, and it can lead to chronic pain. And that chronic pain can potentially lead to instability or lack of movement. And the instability can lead to osteoarthritis eventually later on in life.
Wow. So anybody who has shoulder osteoarthritis knows that it's a real problem.
Yeah, you don't realize how much you actually use your joints until you find out you have pain with those motions. Absolutely. Yeah.
Yeah, one of the things that I tell people is that the hand includes everything from the fingertip to the shoulder blade. So if you're reaching forward, you're causing the shoulder to move, and so if something is painful,
you have no idea how smart that statement was. The hand actually does extend all the way to your shoulder. You can even take it further and say into the rest of the body, but let's just keep it simple and say, when I grab something, what actually happens? If I go to pick up this scapula, what happens is I had to engage muscles all the way from here, all the way up my arm to stabilize. And as that weight gets heavier and heavier, or the forces get stronger and stronger, I need more power and stability up here in this area. And if I've been sitting at a computer desk, or I've not been doing regular exercises where I'm stuck in a position like this on a regular basis, my muscles become weaker. That means the ligaments have to take up more of the slack on this stability of the shoulder, and it can potentially lead to instability that way.
Can you talk a little bit about the relationship between a weak muscle and a tight muscle?
Yep, absolutely. So there's a couple of things to understand. Number one, if you're looking at a weak muscle, it means physically its contractile strength is less, so it can generate less force, or the nerve supply to that muscle isn't initiating the responses as well. So it's an important thing for us to get. It's not only just physically how strong the muscle is, but also the nervous input. All right. Now, versus a tight muscle, if you sit in prolonged positions for a long period of time, muscles go into what's called contracture. And contracture is not a contraction where the muscle can get shorter and longer like you when you move it. It's sitting like this, and then for another year, and then for another year, and then for another year. And slowly over time, you lose flexibility in that tissue. And that loss of flexibility is what leads to muscle shortening. In fact, it'd be the fascia as well. And so you're looking at changes over time because of lack of use and flexibility training. Some of us experience, yeah, go ahead, sorry.
One of the things that I try to explain to people, and I'm pretty sure you could do a better job of this than I can, but this idea of wanting the full length of the muscle. So a flexible muscle is going to be stronger because you can go further and keep the muscle working all the way along, the body of the muscle, the belly of the muscle. But if you've got contracture, you can't go very far. So it just keeps getting tighter and tighter.
Absolutely. And if you look at it, one of the major signs of aging is a loss of flexibility. So as you lose flexibility, you are effectively getting older because of it. So when you're looking at the full range, our real goal here is to have flexibility with strength in that entire flexible range. A lot of people can get way out into ranges but have no stability or flexibility there. then your chance of injury is going to be way higher if you get into that position and you have no strength to contract out of it. If you look at a lot of joint dislocations that happen with this glenohumeral instability, they happen at the full end ranges where someone is all the way back here and then they go a little bit too far and it dislocates the joint. And that dislocation leads to eventually osteoarthritis and other injuries around the shoulder.
I'm wondering if you're more prone to a bad injury if you don't have flexibility. Like if this is your flexibility and you suddenly were
Yep.
pushed into another position, if you had the flexibility, maybe nothing would happen.
True. So there are some caveats to that. Absolutely. If you look at elite level athletes like rugby players, they want decreased flexibility so they have a smaller power range. They can actually generate more power. But if you overpower them, they are going to have an injury sooner because my shoulder can only move to here, exactly like you were saying, and then you push me back a little bit more. The only way I can get there quickly is by tearing and damaging some of the tissue. Versus if I have more flexibility, I can find that range all the way back there and not have tissue torn. Now my strength will probably be a little bit less, but still it will be a functional movement unless you really push hard. I'll give you an example because I do jiu-jitsu on a regular basis. A lot of the people who I spar with, they can use Americanas and Kimuras to try and finish you off, where basically the person is trying to dislocate your joint. Well, my shoulders are really quite flexible, so most guys kind of tap right about here, but I can wait a little bit longer and get back into a range, something like that, before I actually get my joint tight. So I have flexibility to go a little bit further. I just don't have good strength at the very end. So I can't expect myself to do high power movements out of that.
Well, there's certainly something to be said for moderation and balance, I think.
Absolutely.
I mean, you know, not all of us are big athletes and everybody's got their favorite sport, but I do think it's good to do things in a balanced fashion and do cross training. I mean, I study a lot of ballet, and that's one of the most dangerous sports. If you think of it as a sport, it's more dangerous than football, I think.
It is. And
But
if you look at most of the things that you're talking about, for most patients, you don't realize it. As a patient, you have every right to be treated like an elite level athlete. Your body is moving through the same earth and planet as anybody else. And that means that you should be having the same care and expectations. Now, are you going to go run in the center of a football field? Are you going to perform at the London Ballet or anything like this? No, but you still have to have abilities and scales of function.
thank you so much for saying that. Is there anything you want to add about glenohumeral issues while we're on the topic?
Yep, just super quick. It is not a death sentence. You can recover from these injuries if you have glenohumeral instability. There's lots of options you have available. Generally, your goal is to start with the most conservative options first, and that's going to be something as simple as basic range of motion and some lightweight movements. And at the very end range, for people who have shoulders that physically just drop right out because they're so unstable, there's even surgical interventions that could be done. But you have lots of time to heal up these injuries and potentially see better outcomes with them.
Well, thank you so much again for coming on to the show. We really loved hearing all of your wisdom. And thank you all for watching. Please subscribe to the show and come back because we're going to be talking again with Dr. Vizniak about other exciting topics.